Are there any special foods you should eat when you're breastfeeding? Well, the good news is you can have pretty much anything you like. So hooray, you can have your sushi and your blue steaks or whatever it is you would like to eat. Keep yourself healthy, but there's no taboo really on any food. Now, you might read in different cultures, different foods aren't recommended, but there's not a lot of evidence behind most of those. So, like everything, just nice foods in moderation, nice balanced diet, and you should be fine. Breastfeeding burns 350 to 500 calories a day, so you might think, great. Personally, I took all those calories in cake, but maybe you have a better but more balanced diet than I did. What about caffeine? Well, caffeine does pass into your milk, and it's pretty hard for a baby to get rid of the caffeine. So sadly, you have to stick to the pregnancy guidance for your tea, coffee, chocolate intake. Your babies are used to that kind of amount of caffeine. If you went back to a 6 espressos a day habit, unfortunately your babies would be a little bit wired, and that's not something that you'd like. What about medicines and breastfeeding? Well, I would suggest it's always a good idea to check with your pharmacist whether your medications are okay for breastfeeding. We think that ibuprofen and paracetamol that you have for postnatal pain relief are okay for breastfeeding, but things you have in your cupboard at home like codeine are definitely not okay. So it's so important to make sure that you have the right medicines for breastfeeding. The contraceptive pill, the combined pill, is no good for breastfeeding, but the mini pill is. If there's anything that you're worried about in terms of medications, do please check with your pharmacist.